So grab your headphones, let the journey start. With Suzy's Vegas tales, she's stealing the heart. In the city of dreams, let's laugh and play. Suzy's Las Vegas podcast, come join the sway.
Well, hello there. Happy Tuesday. We're back again. And this is the month of June, and we're celebrating Brain Health Month. Is that correct?
That's correct.
Yeah, Alzheimer's awareness and brain health. Yes.
Beautiful. See, I knew I could count on you.
Well, it's a team effort
Yes,
here.
both of you, Dangle and Daughter here, and we are back to our series. You know, we've had so many people send questions about what they want us to talk about, and I'm so appreciative for that. We're going to go back into what we talked about last week, and then we'll add some new stuff to it. How's that?
Yes.
Oh, and then kudos to you two. You're going to have your coffee club pretty soon,
Yeah,
aren't you?
yeah.
You want to tell everybody about that?
Sure we do. Yes.
Okay.
We're getting together next Monday at 9:30 in the morning at Landwehr Coffee in Charleston.
Okay.
And we're just having sort of a meet and greet.
Well, that'll be fun, won't it?
It's a different kind of support group.
Okay.
I
So
would-
tell me more. I want to hear it.
Well, you know, Nancy
What
and
time
I.
is it? It's Monday.
Yeah, 9:30.
Okay.
Nancy and I really want to change what dementia looks like in our society, and we believe inclusion and community and just normalizing. Hey, there are people living with cognitive changes. They come and have coffee also. So we're inviting some what we call care pairs that we really
that's
know.
wonderful.
A person living with a cognitive diagnosis or changes and a care partner, all just having coffee together, and we make things fun.
Chit-chatting.
Yeah.
Normalcy.
Yeah.
You know,
Bring it
suddenly
back, huh?
you get a diagnosis and nothing's normal.
You know, and
Yeah, true.
there's all different types of support. So this is kind of bringing a circle of people who are kind of in the same kind of situations that you can realize you're not alone. Maybe somebody else, you can make friends, new friends.
It's so important to know, to realize there's so
Absolutely.
many of us out there, and that there is something that you can do about it. There is.
Yeah.
So this is brand new to us.
Yeah,
However,
we're
we're
just
excited.
launching it.
Well,
and
yeah, I'm excited
Nancy
too.
and I, we
Wow.
love to do themes. So, like,
What's the first one
The
gonna
first
be?
one is wear your favorite color.
Okay.
So we want everybody to show up bright, or black works
Yeah.
too, white works too. That if
Whatever.
you
There's
look
no-
chic and you're
Yeah.
black.
Yeah.
Yeah.
And
As
and
long
then,
as they don't come in pajamas, right?
Well, we don't care
You
about
don't
that
care.
either.
Okay.
if that gets you there, we're good
Okay.
with
Yeah,
Yeah,
we're good
okay.
with that.
And then just to have some kind of icebreaker conversation,
Yeah.
you know, why do you like beautiful blue? You know, why
Yeah.
is yellow your favorite color?
Yeah.
Or
Sure.
just normal stuff.
Yeah.
And so we're going to have other themes like sort of like a breakfast at Tiffany's where you bring that
Oh, how fun.
sentimental piece of jewelry
Yeah.
that you got, and you can share a story where it came from. And we get to learn to know one another as people.
It is a community. You know,
Yeah.
you get a diagnosis of Alzheimer's or dementia of many forms, and
Sure.
you know, you sort of live within that title.
Right.
And what we're trying to say is titles are only that.
True.
Somebody
How
says
true.
you've got early onset Alzheimer's, which was what I was told originally, and suddenly you can't make decisions for yourself. You
It had to
suddenly
take your
sit
breath
down.
away
Well,
when
it
that
does
happened.
take your breath away.
Sure.
If you think there's a problem, we do need to go. We do need to go in, and
Yeah.
I mean, we hear enough about it now that you hear
Right.
enough about it that
Absolutely.
you start to pay attention. And
Yeah.
and if that's the thought, gosh, I really need to have this checked.
Yeah.
Well, the good part of that is it may not be. They might say you don't have it. You've waited a year, right? And they say you don't have it. What if you had gone a year ago?
Right.
We have to be careful. It's
Sure.
not. It is
Could be the
scary.
wrong decision.
Yes. And so this is our way to say, hey, there's no dementia signs. There's no Alzheimer's signs. There's
Right.
no.
No,
Yeah.
you know, tucked away conference room
In the back.
meeting.
Sure.
So we really just want to have an opportunity to socialize and, take away the loneliness factor.
Oh, yeah.
That's definitely.
Well, sure, and people have
Involved.
something to look forward
Yeah.
to. And like-minded people.
Yes.
This
Yes.
is wonderful.
Yeah, and we're very gracious to the
Yeah.
owner of Cafe Landrer,
Well,
Don.
hi.
Hi, thank you
Hi,
so
Don.
much, because he was so
Yeah.
nice to say when he
Yeah.
heard what it was about.
And-
what
and-
he graciously is accommodating. So
Oh,
that's
that's
going to be like the
wonderful.
last Monday and every month in Las Vegas here.
Okay.
It's in Boca Park.
Sure. Yeah, I know where it is.
Yeah.
I've not been in there. So tell us a little bit about the place.
Very Mediterranean.
Okay.
Which
Very.
guess
Like
what?
that.
Is great brain health food.
Okay, good deal.
And yesterday, as warm as it is, yesterday they have the misters outside on the patio.
Really? Was it really nice?
Well, we sat inside, but that works.
Oh, good.
Yeah,
Good.
it's very nice. Very,
Yes,
very nice.
it has a very good vibe.
So
and-
he's open for what? Breakfast, lunch,
and dinner,
dinner.
and does special events.
Oh,
Yes.
wow. What about happy hour? Do they do?
Oh, yeah.
They do happy hour too? Okay. Well, there
Every-
we are. We have many reasons.
We've got many reasons to go.
How good is that?
Yeah, so
Yeah.
we're excited about that.
Well, you know what?
thank you for asking.
Well, yeah, I'm so excited.
So-
I'm a big cheerleader for you
Yeah.
guys. And then next week, you won't be on the show. You're going to have your own talk, and that's at United Way. Is that
yeah,
correct?
United Way Women.
Yeah.
And
Yeah,
It's
we're
on the
really
30th.
excited about that.
Yeah.
they're a grand group of just
Oh, yeah, they're wonderful.
proactive women. And
I love
taking
United
community.
Way. I really do.
Yeah.
I was so blessed to go and meet
Yeah.
a lot of wonderful people
Yes.
there. It was fabulous.
Yes, they've
Yeah.
been really adopted us
Yeah.
in a beautiful way.
Yes.
Yeah.
A lot of the community just needs to hear this little more positive.
And women
take.
helping women.
That's the big thing.
Yes.
Yeah.
And
it's not a
during-
dirty word. It's a
Is
good
it-
thing.
Yeah.
Women
No, it
helping
is.
women.
I
Yes.
know, yes.
Yes.
And
Yes.
in Alzheimer's, where 2/3 of the people diagnosed are women, and the caregiver end of it, it's the same. 2/3 are women.
Really?
So we really do
I did not know
need
that.
to look forward and do our own due diligence.
Sure.
Right?
Absolutely.
Do our own due
And help
diligence.
take care of one another.
Yeah, one another.
Yes.
Yes.
That way you have a pal that'll check,
You do.
you'll meet new people
That's
and
right,
you have
you
a
do.
pal to check
Yeah,
in on
pal
you.
to check in.
Yeah,
and
I mean, I'm
create-
blessed to have both of you guys.
and
Yeah.
create
Yeah, it's
connections,
wonderful.
right?
Yeah.
Really good friends.
Yes.
Yeah.
Yeah.
And you never know who's going to show up, do you?
You never know.
You never know.
That's
Yeah.
the fun part. Though,
It is.
isn't
Yeah.
It is the
Yeah.
fun.
And-
It is the fun. Everybody says, you get the title in this realm. It's the end. No.
It's just
It's
the
a
beginning.
new beginning.
Look at
And
you.
Look at, yeah,
Yeah.
I'm really,
Yes, we are so
I-
proud of you.
well, thank
Yes,
you so
yes,
much.
yes.
Thank you so much.
Yeah.
We've got to be grateful for where we are,
Yeah, that's right.
right? Because it could be so much worse.
Yes.
And so, just very grateful. I have tears in my eyes. Well,
Yeah. Well, that's a good thing.
Yeah.
That means you're happy too.
That means it's from the heart and
Yes.
real.
yeah,
It
really,
is.
really.
For sure.
Mm-hmm.
Well, it's a wonderful thing. Well, last week we talked about all kinds of things, but I want to go back
Go
to a
back.
couple of things if I can. I had a couple of questions about the prescriptions. When people get older, they go to the doctors. The doctors, not all of them, but maybe the people are asking for more meds, more meds, more meds. What happens when you take too many meds? Can you
Yes.
tell me, please?
Yes.
Yes, so some people are running around 10 different medications
Right.
or more, right? Isn't
Yeah.
that
Yeah,
something?
a friend of mine had it in a tackle box. You got
That's when you know you got problems.
I know this person.
A tackle box. Now, I've
tackle
heard
box,
The little
full.
pill box.
Yeah,
those,
well, he was
he
a
has-
fisherman, and
He took it all with him?
Well,
Oh,
the
my
tackle box
goodness.
became the medicine chest.
Oh,
Oh, wow.
It was full.
That's funny. That's very funny. I love
Yes.
that.
Well, that's a good one.
That is a good one. That is a good
So,
one.
actually, that's a good play
Yeah.
for if you're going to care for somebody,
Yeah.
a male who
Yeah,
you know
it-
what they like.
Yes.
Yeah, a tackle
Yes.
box.
Yeah,
Yeah,
and
fill it
maybe
up.
a lady, a makeup kit, days.
Well, you know, we get so used to doing what?
Yeah.
Holding out our hand and letting somebody give us yet
Yeah.
another something.
Right.
How do we know what's happening?
Correct.
How do we
Yes.
know, Ms.
So
Pharmacist?
I am a pharmacist by
Yes.
training, and then
Yes.
I spent time at the FDA. I have to. I'm going to be really honest.
I
By the
want you
time
to.
I got out of pharmacy school, I was like, "Wow, all these drugs have side effects. There is not a single drug that you can take that doesn't have some other downward."
Yes.
It's like switches are being put on and off and on and off, and if it gets to certain levels,
Correct.
so, and then we complicate it a little further with our lifestyle. Are we consuming alcohol? Are we
What happens
are we
when you
taking
do
over the
that on top
counter
of-
drugs,
Yeah,
right?
all of it.
All of it. Then we go to this specialist, and he or she prescribes something. Next thing,
Right.
you're on 10 medications,
Right.
right?
Exactly.
Right? And then all of a sudden you're dizzy, or you have dry mouth, or you have these symptoms that are side effects that you go searching for another drug
To take care of
take
that.
care of that side
Right.
effect. So
You're
a lot
exactly
of people
right.
in the pharmacy field, we are really talking about this polypharmacy problem of too many medications. I think it's compounded too with people getting confused about when they're giving it, which
Right.
ones they're giving with what.
Exactly.
Right? And then the other lifestyle things we might be doing that exacerbate, make that drug level in your body go higher than normal.
So let me ask a question. Okay, you're taking all of these pills.
Mm-hmm.
All right. Then you're adding, say, 2 drinks, 3 drinks, 4 drinks a day.
Okay.
What does that do to
So
you?
let's
not
I'll
good.
Just simple biology.
I'm just curious,
Right.
yeah.
You swallow a pill and it'll probably be absorbed in the stomach and it goes in the bloodstream,
Correct.
right? Okay.
Okay.
And then it has to be broken down by your kidney or your liver, usually.
Okay.
Usually the liver.
Okay.
But now you drink on top of it. So blood alcohol is going up, and the liver is now having to say, am I breaking down the medicine or am I breaking down the alcohol? And you're starting to compete at the sites
okay.
that do these processes for you.
Right.
Then you add on some aging. Every organ's,
Gets a
Suzy-
little older as time goes on,
Sure.
right?
Not
Absolutely.
quite like you could really drink at 22,
Yeah,
right?
yeah,
Versus you 88.
Yep, that's it. You got
Just
it.
like anything else.
Right.
So all those factors start to become a problem where you're going to have a fall. I feel dizzy. I feel nauseous. I feel
Right.
your body keeps talking.
Keeps telling you.
It keeps telling you this
Yeah.
situation is not working.
Right. Exactly.
And then you fall down and you break a leg, and then that doctor gives you more.
Right.
Well, and then if you get on pain pills,
Yeah.
then you
Right. Then
have
trying to get off
off
of
the
it.
pain pills.
Oh yeah, because
So
you can
it's
get
sort
hooked
of
so easy.
just a cascade. Certainly, I think I've heard now maybe anytime past 5 medications.
5?
Anytime after 5, you probably do have interactions going on. I suggest, if you can find a pharmacist that will sit down with you
And tell you-
kind of
Look at your meds.
Well,
Yeah.
take this one in the morning because it'll
Pay attention to that. Isn't
Yeah.
that
even
really
the time
important?
of day.
Yeah,
You
because they
know?
say take this one in the morning and this one in the
And
evening.
now,
and I know people that just
Yeah,
Take
they
'em
put them
all.
all together.
And
They
take
don't
'em all together.
hardly
Yeah.
even any water.
Yeah.
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 It's like all stuck here.
Yeah.
Yeah.
And then other little pharmacy factors. Some drugs should never be cut, crushed. But older people have trouble swallowing, so we do.
They should never be cut or crushed.
Well, some can, some can't.
Well, like which ones can't?
Usually the ones that say extended release.
Oh, okay, sure.
Okay.
Yeah.
That makes
They're
sense.
in this little waxy matrix sometimes
Yes.
that has to release the dose once and then release the dose 12 hours again. So if
Now
cutting
we've-
that, you've wrecked that whole system. Maybe.
Sure you do.
Maybe, but
Yeah.
anyway.
Wow.
Wow.
Once you get in there is a lot we could talk about.
Oh,
Just
yeah.
in medication
I get it.
delivery. Also, too, we're busy and maybe we don't have a lot of time to be a pharmacist, right? And handing
don't
the
know enough.
medicine and
True.
know enough. And then just, I would tell people, if you are put on a new medication, really pay attention for the next 2 weeks. I always say add one at a time.
That's smart.
So
your body gets
which
used to it.
which one might be causing the problem.
Oh, that's even better.
Right, because sometimes we get 3 medications all at once, and now was it
What do we
this
do?
pill, that pill, or that one? And also, I really believed, like, in my mom's care, I got to the point, well, okay, where are we in life? What is our goal? Is it
Right.
to live to 100 with every not well, right? So I eventually pulled her off, like the cholesterol medications, things that, where
It's not gonna.
it's not
no.
right now.
No.
We're past
You're past it.
that,
Yeah.
and it was good. And she got a whole lot better.
Did she?
Even the hospice nurse said, "Oh, we see this all the time when you start taking them off the
meds?
Some
Yeah.
of the meds." Yeah,
Yeah, they start to feel better.
yeah.
And
she
what's
was-
the first thing that they suggest that we do when you go in for a Alzheimer's diagnosis?
Is that where we talked about drawing the
That-
clock?
Oh,
Yeah.
yeah. What is the first thing, if they see that you have a problem, they want to put you on medications.
Oh, yeah.
Right?
Sure.
And
What do they? What is one of the meds that we talk about in Alzheimer's? Can you tell me some of the names?
well,
of the meds?
Aricept is one.
Aricept.
Aricept, yes, and
Namenda.
Namenda. Thank you,
Namenda.
Memantine. There's patches and things. There's a little category, so all for symptomatic. It doesn't reverse, or it might make somebody perform a little better
Sure.
while those neurons are in place. But as things decline, they might not work so much anymore. Some do
Okay.
have side effects of nausea type of things.
So then
or-
you take the side effects, because most often there are side effects. And it adds to it. It adds to, stomach.
Oh, yeah. You could get ulcers or
all kinds
and
of-
your stomach's upset.
Yes.
and
So now
everything.
you don't feel good on both ends,
Yeah.
right?
True.
yeah,
so-
yeah. So again, weighing risk and benefit, risk and
Yes.
benefit. Every
Yes.
time you decide, am I going to take this or not? Understand what the side effects are.
Yeah.
Understand what potential benefit could be.
Sure.
And you make that decision for you and your loved one
Absolutely.
there.
So, it's an interesting thing when a white jacket walks into the room, it's starched and it's really, and
Yeah.
and they say you have early onset. And here is the prescription pad, and he's writing on it. He says, here, take this and come back in 3 or 6 months, whatever it was.
That's it. I mean,
And
that's
that's it. Yeah. And I looked at
Did
him
you say,
and my
excuse me, sit down?
Yeah. No, I
I
didn't.
would.
Yeah,
Yeah.
because of that white starched
Yeah, you figured he knew what he was doing.
authoritarian
Yeah.
garb that he was wearing.
Yeah.
We think that they know everything.
Yeah.
I didn't do that, and I don't know why I didn't do that.
good for
because
you.
I'm very
Yeah.
normal, like
Yeah.
everybody else.
Sure.
So, and I used to say very softly, I've never taken a drug for Alzheimer's. So, most people do. We're afraid. We want this to get better. We'll take the aspirin. We'll take the across the. We want to feel better.
Right.
This is going to help because after
all,
the
that's what he
doctor
said.
gave it to me.
Yeah.
This is going to
Yeah.
work.
Yeah.
And working with some really great physicians, they want to help.
Sure.
Right? And
Sure.
they've been trained in the medical world to do that. And
Right.
a lot of people come in with wanting to take something, the action of wanting to do something even,
Correct.
right?
Yeah.
And so
they want to get better.
Starts
They
with
want to feel
taking
better.
a pill.
and some of the personal friend doctors that I have had have said, people are begging me
Yes.
for
pills.
something.
Yeah.
Okay. But he was wise enough to know, when I give a diagnosis, what you really need is a speech therapist, you need a cognitive training,
Right.
you need a dietitian, you need a social worker to help you navigate, you need the rest of the team, you need other types
Right.
of care.
Exactly.
Right, but now we do have some autoimmune styled drugs that are by infusion that can remove those amyloid plaques, and so you'll see a lot of talk about that on the news right now.
Right.
That
I've
takes
seen
a
that.
specific knowing exactly where you are in the process through
Yes.
some biomarkers, blood biomarkers. So it's
We're
a
getting-
complicated
It
landscape.
is, yes.
Yeah.
And
People-
everybody's doing everybody is wanting to help. Everybody,
Sure.
I mean, doctors are not the bad guys.
No.
They're the in-between guys.
Right.
But you, as the person listening, can say, whoa, wait a minute. I'm not saying forever, I'm just saying for right now.
Yeah.
I'm going to think this thing out because
Yeah.
I don't know enough.
Right.
And I think that's a good measure.
Yes.
It was a good
Absol-
measure for me, let me say. Everybody has their own feelings about this. And people that elect to take medications, if you're into it, maybe that's the best way to go. That just wasn't my way.
No, I'm with you. I'd like to, really take a look at the whole picture instead of, just. Yeah,
Yes.
But you said something, both of you, last week that amazed me. When you talked about UTIs, I've got a friend of mine, and she constantly has UTIs, and she's 87. And tell me about that. Like,
Yeah.
they give you medications and that, but you mentioned.
Well, and you also can do a
Well,
lot for yourself.
Yeah.
with the
I
UTI.
just mentioned it because
Yeah.
it can create a cognitive confusion.
Yes, that's what I'm talking
the,
about. Yeah.
And the real difference maker is that it's sudden. It seems like somebody was going along great, and now all of a sudden it's a quick.
Fell off the hill.
It's a
Mhm.
quick
The-
kind of
yeah, the
infection.
mountain.
The
Yeah.
brain responds to trying to prevent the infection.
Mm-hmm.
So, if you notice someone that has, some cognitive change and it's sudden,
Right.
that's usually not like Alzheimer's disease, right?
No.
That is a slow, steady, or
Yeah.
quick process, but
Yeah.
not overnight kind of thing.
Mm.
Yeah, so, just sort of UTI lady, be wise.
Yeah. Yeah.
Yeah.
what we're wearing down there, and then,
Yeah.
drinking a lot of beverages, and
Yeah.
or trying to keep it
But
fresh.
mainly, like to flush, like water, a lot of
Yes,
water,
yes.
and soft, like
Yeah.
things what about tea? Does that help, or does that?
So on the
Sometimes it
brain
can go
health
the other
list
way.
is
Yeah.
black tea, green tea. Herbal teas are great because they have no caffeine. But again, staying hydrated. As we age, we lose our ability to kind of that we're thirsty.
Oh, yeah.
We forget to drink. We get busy. So that is
Yeah.
a big
It can really take a
factor.
toll on you if you don't.
can,
And
it
right
can.
now with 110 degree
it's
out
hard
there.
out there.
Well, let's
Yeah.
take a sip.
Oh, that's-
Okay,
well,
let's
cheers
do
to
Cheers
that.
to you.
Cheers.
We just have water
yeah.
in here. It's
Yeah,
very
it's just,
good.
yeah.
Hydrate.
Yeah.
And if you are living with somebody who has dementia, a great trick is to, if they're not really keen on drinking, put it in an old favorite style of cup.
Yeah.
Could be like a, I don't know, Disney sippy cup. It
Sure.
could be like a wine glass. It could be a beer glass. It could be a coffee cup. Yeah, I think
Yeah.
I would want to hold on to a coffee cup.
Sure.
Yeah. Yes.
Yeah.
Weird like that.
Yeah,
But
that-
anyway,
that
use
makes
different
sense.
methods or put in flavor or like fruit
Yeah.
or
People
other-
that don't like
Well,
taste
just
of
water.
Yeah.
Yeah.
And
Yeah.
there are a lot of people
Well, they
that
have the
don't.
little drops and that's
Yeah,
Yes.
but we have to be real
Yes, it
careful
says.
about all the artificial things. I think
Yeah.
artificial color, artificial sweeteners.
because that can affect too, can't it?
Yeah.
Yeah. Wow. There's a lot to think about. isn't
There
Yeah.
is. Yeah.
Yeah.
I know. So we were talking also, I think you wanted to talk about other medications.
Yes. Yes.
I will say, like, I know the doctors who are kind of trying to treat somebody for Alzheimer's, at least the ones I've worked with, they
Okay.
are always trying to hey, take a look at what could we take off. And guess where they go first? Are some of the sleeping pills.
Really?
Yes, they are really known to create some cognitive dysfunction.
Okay.
So some long-standing favorites of I have to have my sleeping pill. That's one of the first places they try to go to try to eliminate that.
Okay.
Even the over-the-counter ones, the ones that say PM, Benadryl, some of the allergy medicines, that can cause some brain fog. It's not meant to be used every night.
Okay. So what can you use in place of the sleeping pill or like the Benadryl? What would work?
Yeah,
if
well,
people have
like the allergy
allergies or
thing, a temporary use of it.
Yeah.
But, some people
use it continually.
Continually.
Yes.
Yeah.
And would it not depend upon how many drugs, the other
and you need
medications
to
they're
look
taking?
at, again, the big picture
It might not
of
mix
everything.
with the other
That's
drugs.
right.
Right. And
Yeah.
There's no easy measures, is there?
You know, it's interesting. It reminds me of something that happened to me years ago when I was young, many, many moons ago. I've been in business all of my life. And at that time, I had gone to a show in Pittsburgh. I lived in Pennsylvania. And we went down to a show, and we're in there, and the doctor, because that's what I'm thinking about when you're talking about this. There was a doctor that prescribed a couple different medications. His partner was there. He had gone on, the doctor that I went to went on vacation. His partner was there. I was having problems with like a flu or some kind of problem. And he prescribed a different medication. So from St. Mary's to Pittsburgh is 3.5 hours away. So we're lucky here. We can go to Costco 3 miles away.
Right.
For me, when you're up in a woods up there to go down to Pittsburgh, it's a long way. So country girl, So I get down there and I'm in there and I'm walking around and I'm going to buy the things I need for my store. All of a sudden, I stopped and it was like I couldn't move.
Oh.
And I felt like I was swallowing my tongue.
Oh, my.
Oh.
Ended up going to the doctor at the emergency
Hospital,
room.
Oh, wow.
And I think they did a shot of, what was it, Benadryl or whatever,
yeah.
but it
You were
scared-
having a reaction?
Oh, my
Reaction
God.
to the medication.
It
your
scared the
tongue.
hell out of
I
me.
bet.
'Cause I've
Started swelling.
I've never had that
Oh,
feeling
that's
in my
good.
life. I don't recommend that for anybody. No,
Yeah.
you got to know what to do in a case like that because
Yes,
things
yes.
really can go wrong
Quickly.
very
Yes.
quickly.
Yeah. Oh,
Wow.
my.
So if
Yeah,
we-
and one you never forget.
No,
Huh?
no, it brought back memories
Oh,
when
no.
you two were
Yeah.
talking
Yeah.
about it. I was thinking,
Yeah.
oh my God,
yeah.
that was when I was a young girl, in my
And you
20s.
still are. Yeah,
Yeah, I'm
that's
still
why
young.
you can feel.
Yeah, yeah, we're only as old as we feel. Well, I feel
That's
awfully
right.
young. Yes, but it is interesting. You're right. People don't think about the interactions, do they?
No, we're looking for quick fixes.
Of course.
Right?
Yeah, that's what
you know,
everybody wants, a quick fix.
It's a quick fix. And frankly, I don't think in this realm that we're all talking about.
No. Yeah.
There is one. You really do need to get in. You got to become a partner in your own health. You cannot just hold your hands
Sure.
up.
Yeah.
And I
That's
felt,
true.
again, like going back to what is our strategy here? Okay.
Right. That's exactly
Like,
it.
where are we in life? What do we want at this point in
Correct.
life?
Yeah.
Right?
Everybody wants different things, but at
And
this point,
then,
what do we want?
and your care dynamic,
Yes.
what do we want?
Correct.
Right, together.
Yeah.
And I think you just kind of need to sit back and look at the bigger picture, what's
You're
going
right.
on.
Absolutely.
There's some geriatricians out there that also are great.
Geriatrician. I've never heard of that. Is
Yes,
that for
that
older?
older
Nutritionists
people.
for older?
No,
Well,
doctors.
doctors.
That
Oh,
look
okay.
Yeah.
that are specialized in the aging body.
I would know
Okay.
nothing about that.
No, you're
I would
younger
know
than
nothing
us.
about
I'm just bringing that up. Not these ladies here.
No.
I count.
You're only 24, aren't you?
That's right. That's right.
Unfortunately, there's not enough of them.
No.
But again, they really look at what medications are really needed now.
Yeah.
Right?
Yeah.
We're
What do you
85
really need?
What do you want? What is your goal
Yeah.
right now? Right?
Well, you
do
know,
you need
you're right. You're exactly right. You know, before we end today, I'm getting off of a lot of my medications and I'm feeling wonderful. You know, as you take this one off, you know, you start to feel better again, you know, because I told you I broke my knee in January, but it's
Yeah.
so nice to be able to just do things and, you know, and if you've...
And
if
there's
you-
a way to do it.
Right, and if you've got an
Yeah.
acre of pain and out rather than
Yeah.
the pill lately, I've been
Right,
doing
and
like
then-
BioFreeze,
but
you know,
then-
spraying
sure,
that
and then
the
it-
Chelsea. Yeah,
as we had mentioned before,
Sprays.
to putting more of the mind diet in, right?
Yes,
America
absolutely.
needs an oil change. We got to get away from the seed oils and go to,
Correct.
you know, to olive oil.
Oh, yeah.
And, you know, avocado oil maybe.
It starts
And
here.
cooking.
yeah,
It starts here.
Yeah.
Who cares more than
yeah.
me?
That's right,
Right?
about you.
I mean, about me.
right,
Because we can.
Yeah.
When we turn all that over to someone else. And sometimes we have to, and we
Yeah.
have to be willing to do
right.
that.
Yeah.
But as long as you can still do that,
Right.
you should,
Yes,
absolutely.
we got places to go, people to see, and
And
things
we-
to do, don't we,
Yes,
Suzy?
Yes,
We
we do.
do.
Yep. So remember us, if you have more questions, be sure to send them in, and we'll be glad to answer them for you. And that's our show for today. And girls, I am really excited about what's coming up for you in the next week.
Yes.
So
Happy
y'all,
to share.
yep.
Bye now.
Take care. Bye.
So grab your headphones, let the journey start with Susie's Vegas tales. She's stealing the heart in the city of dreams. Let's laugh and play Susie's Las Vegas podcast. Come join the sway.